Chapter 15, the Digestive System. The function of the digestive system is to break the complex organic molecules we ingest in food into smaller subunits that can be absorbed into the bloodstream for delivery to cells. These substances provide fuel for growth and repair, as well as energy for our daily activities. The structure of the digestive system is called the gastrointestinal tract, or GI tract, into which there are several accessory organs release their secretions. Digestion is both mechanical and chemical processes involved. This image found in your textbook is just an overview of the gastrointestinal tract, beginning at the mouth and ending at the anus. Kind of breaks down some small bullet points that you might want to review for major functions. We will be going through many of these throughout the presentation. The GI tract is just a long hollow tube. The lumen is the inner area through which the food travels. Begins at the mouth and includes the pharynx, esophagus, stomach, small intestine, and large intestine. Along most of its length, the walls of the gastrointestinal tract have 4 layers. The mucosa is the innermost moist mucus-secreting layer. This lubrication allows food to easily pass and protect the lining from rough food substances, as well as digestive enzymes. Some areas are highly folded, which also increase the surface area. Below the mucosa is the submucosa. It's connective tissue with nerves and blood and lymph vessels. The muscularis is a muscular layer. It's a double layer of smooth muscle, except in the stomach where there are 3 layers. The muscularis is responsible for movement of the materials through the gastrointestinal tract. The muscle layer churns food until it's liquefied, mixes it with enzymes, and propels the food through peristalsis. The serosa is the outermost epithelial tissue supported by connective tissue. It secretes fluid that lubricates the outer gastrointestinal to reduce friction with surfaces of the intestines and other abdominal organs. And so this takes us through the layers through which we just discussed. The lumen is just the opening through which food passes. The mucosa is the mucous membrane that secretes and lubricates the GI tract. The submucosa below it is with the nerves and the blood vessels and lymph vessels. The muscularis is the muscular layer, and the serosa is the outer layer secreting the serous fluid and acting as a lubricant. Regions of the gastrointestinal tract are specialized to process food. Mechanical digestion is the actual physical breaking of the food into smaller pieces, whereas chemical digestion is the breaking of the chemical bonds so that these complex molecules we ingest are broken into the smaller subunits. This chemical digestion produces molecules that can be absorbed into the bloodstream and thus used by cells. The digestive organs include the mouth, the pharynx, esophagus, stomach, small intestine, and large intestine. Digestive organs are also aided by several accessory glands we'll be discussing: salivary glands, pancreas, liver, and the gallbladder. The mouth is of course, also known as the oral cavity. The palate is the roof of the mouth. There's a hard palate toward the front that's reinforced with bone, and the soft palate toward the back, which is muscle only. The soft palate prevents food from entering the nasal cavity during swallowing. Functions of the mouth is that it both begins mechanical and chemical digestion. It monitors our food quality. It prepares by moistening and manipulating the food for swallowing. The teeth, the salivary glands, and tongue contribute to the function of the mouth. The function of the teeth is that it begins mechanical digestion, breaking the food into smaller pieces. The incisors, clip and slice. The canines puncture and tear, and the molars and premolars crush the ingested food. Teeth, the structure is the regions, the crown is above the gum, and the root is below the gum. Layers of the teeth include the pulp, which is the innermost with blood vessels and nerves, the dentine, which is the hard bone-like structure, and the enamel covers the crown and is non-living. Problems with teeth and gums is tooth decay. Bacteria digest the trapped food and produce an acid which erodes the enamel, causing a cavity. Plaque is basically just an invisible layer of bacteria, mucus, and food that promotes tooth decay. Gingivitis is inflammation of the gums, can develop into periodontitis, inflammation of the soft tissues around the tooth, wherein the tooth would become loose. Swollen gums bleed and do not fit as tightly around the teeth. This pocket traps additional plaque. Bacteria in the plaque can then attack the bone and soft tissues, and the tooth becomes loose. Gum disease affects about 67% of middle-aged individuals in the United States, and is a major cause of tooth loss. There's 3 pairs of salivary glands: sublingual, which is below the tongue, submandibular, below the jaw, and parotid, in front of the ears. They release saliva into food, which acts to moisten the food. The mucus in the saliva binds food, and also saliva contains a specific enzyme that begins chemical digestion. So chemical digestion begins in the mouth. Salivary amylase is an enzyme that begins this chemical digestion of starch into smaller monosaccharides that the body can use. So it's an important enzyme in the body. And so this shows the location of the sublingual below the tongue, submandibular below the jaw, and the parotid right in front of the ears. The tongue is a large skeleton muscle and important both in speech as well as in food manipulation. The tongue helps to form food into a bolus, and this is what the soft mass of food suitable for swallowing is called. Once the food leaves the mouth, it's referred to as a bolus. The tongue's also studied with taste buds, which help us to monitor food quality. The pharynx, if you recall, is a common passageway for food, air, and drink, and shared both by the respiratory and digestive systems. Swallowing is a voluntary component. The tongue pushes the bolus into the pharynx. The involuntary reflex is the soft palate prevents food from entering the nasal cavity. As the larynx moves up, it causes the epiglottis to cover the glottis and prevents food from entering the trachea. So this shows the bolus. The tongue pushes the food, the bolus, it's now called, towards the pharynx. That's the voluntary phase. Involuntary phase, the reflex movement of the soft palate prevents the food from entering the nasal cavity. Muscles contract, forcing the bolus into the esophagus. Epiglottis closes towards the opening to the trachea, preventing food from entry. And the muscle ring at the top of the esophagus relaxes, allowing the food to be pushed into the esophagus. The esophagus is the muscular tube that transports food from the pharynx to the stomach. Food moves along the esophagus and other regions of the GI tract through a mechanism called peristalsis. Peristalsis is rhythmic waves of smooth muscle contraction, the muscularis layer. It plays no role, the esophagus plays no role in mechanical or chemical digestion. It's just basically the transport mechanism from the pharynx to the stomach. And this shows the movement of peristalsis, which is this wave-like movement. The food present stretches the wall in one region of the esophagus, triggering the contraction of circular muscles in that region immediately behind the food mass. When it contracts, that region pinches inward, moving the food particle forward. At the same time, the muscles in front of the food contract, shortening that region and widening its wall to receive food. So the movement is just incrementally along, and this process is known as peristalsis.